Joining us live now is Dr. Isaac Bogoch, Infectious Diseases Specialist at Toronto General Hospital. Dr. Bogoch, how are you doing?
Not bad, thanks. Thanks for having me on.
Yeah, absolutely. Good of you to always come on every Tuesday, rain or shine, and help us break down these health stories. So let's talk about cases of walking pneumonia amongst kids that have been really surging in the United States. What's the situation like here in Canada?
Yeah, so for starters, walking pneumonia, they're really referring to something called mycoplasma pneumonia. Sometimes it's referred to as walking pneumonia. It's a bacterial infection. It's actually a pretty common bacterial infection. Cases are seen year-round, but there's usually a greater number of cases of this in the late summer and the fall, which is, of course, where we're sitting right now. It can cause a pneumonia-type syndrome. And it's called walking pneumonia because, as the name implies, some people might feel pretty crummy, but they're not necessarily bedbound. So that's why it's the term walking pneumonia. There's a greater number of cases in the United States right now. There's periodic outbreaks of this. People might remember from a year ago, there was a very large outbreak of this in China. We're very likely seeing cases in Canada. Unfortunately, it's not a nationally or provincially reportable infection, so it's hard to track exactly how many cases there are. But certainly, if they're seeing cases in the United States in greater number, we're probably seeing cases in Canada in greater numbers as well. Not hard to diagnose. Mostly, it's empirically treated. Conventional antibiotics that are routinely available treat it. Sometimes we always talk about amoxicillin as a common antibiotic for children and even adults, but amoxicillin doesn't work with this type of infection. Another very common class of antibiotics called the macrolides treats it. So, for example, a drug called azithromycin is a very common drug to treat it, and it's very effective. Yeah,
and parents should be aware that sometimes kids can have adverse reactions to certain antibiotics, right?
Yeah. I mean, certainly a pediatrician, a family physician, an infectious disease specialist know which antibiotics are better for kids and others that are better for adults. But there's lots of options available for this particular type of pneumonia. It's not hard to treat. It's very sensitive to these types of antibiotics.
Yeah. OK. Yeah. You kind of answered my follow-up question about, amoxicillin might not being as effective for treating this. And you offered azithromycin. Thank you for that, doctor. Next up, I want to talk about COVID-19. Yesterday, we reported that the vaccine targeting the KP2 variant is now available without a health card now. And, people 6 months and older are being advised to get it. What do you recommend, though? Should people get it, especially if they haven't had their COVID shot in over a year or two or even more years?
Yeah, I mean, I always refer to the National Advisory Committee on Immunizations. I think they've done a remarkable job throughout the pandemic with their advice. They have two categories. They have the should and the may. People who should get it because they're at greater risk for severe infection include people over the age of 65, people in congregate care settings like long-term care facilities and nursing homes, people with underlying medical conditions that predispose them to more severe infection regardless of their age, Indigenous communities. So these are communities that have greater risk factors for severe infection, and it's recommended that they should get it. Everyone else is really in the may category. And of course, we know some people know that this is available and will be going right away to go get this vaccine. Other people may have some questions about it, and I think it's just important that if anyone has any questions about the vaccine, to sit down with a healthcare provider. It could be a doctor, a nurse practitioner. It could be a public health specialist. It could be a pharmacist. There's a lot of capable healthcare providers that can have this discussion with you about these vaccines.
Okay, good to know that the info is up there. Dr. Bogoch, finally, I want to finish on this. The Canadian Medical Association, they want to do away with sick notes to ease an administrative burden on doctors' offices. Would this change, though, have an impact when it comes to the spread of infectious diseases?
Yeah, so for starters, good. Thanks for bringing that up. So for starters, I'm not a family physician. I don't speak on behalf of family physicians. But I mean, this makes sense. I don't think it'll have any impact on the spread of infectious diseases. We know that across Canada, it's difficult to access care. Many people don't have a family physician. Some people that do have a family physician sometimes have difficulty accessing them in a timely manner. Doctors should really be caring for their patients, not writing useless notes for common sense policy of staying home when you're sick. And we also know that people are sick, and the vast majority of people who are sick need to recover in the comfort of their own home. Of course, your doctor is always there to help you out, but many people just know that this is going to be over in 24 to 48 hours, and they just need to sit at home and rest, not schlep over to their doctor's office to get a note that says that it's okay to stay home. So I think this is common sense policy.
Okay, very good. Dr. Bogoch, that is our time this Tuesday, but thanks so much for answering all our questions and joining us. Have a great week. Happy Halloween to you and your kids, and we'll chat again next week. Take care.
Happy Halloween. Be well.